the nurse is most likely to note which finding on the laboratory report. A hematocrit of 60%. Yes, that is elevated, indicating hemoconcentration. Now, for the rule of nines. For your NCLEX and your exams, you must know how to calculate the rule of nines. Over 70% of students get these questions wrong, so be sure to listen close. A big test tip here is I recommend to write out this chart at least 10 times every single day the week of your exam. It's kind of like lab values. You need to know your numbers here. Okay, now as you can see, the rule of nines is used to quickly estimate the percentage of the body affected by a burn. This is called total body surface area, and it's used to calculate the exact necessary fluid resuscitation that is needed and require level of care for the client. So for example, the head and the neck are 9% total, 4.5% for the front and 4.5% for the back, aka anterior for the front and posterior for the back. Now the arms account for 9% total. Once again, 4.5% for the front, the anterior part, and 4.5% for the back, the posterior. And the same thing for the legs, but this is 18% total. So 9% for the front and 9% for the back. Now the most interesting part here is there's only 1% for the perineum. Wait, what? 1%? Okay, yeah. One, womp, womp, womp. Okay, now a commonly missed question here. A client has a full thickness burn to all the posterior body surfaces. Using the rule of nines, calculate the percentage of total body surface area that is affected. Guys, a lot of students get these wrong, so you must know your rule of nines numbers. Okay, now looking at the chart here that we memorized, we know that only the posterior body surfaces are affected from the question. So 4.5% for the head, 18% for the entire back, 9% for the right and left arm, and 18% for the right and left leg. So the answer is 49.5%. Now most exams ask you to round to the nearest whole number. So the answer would be 50% of the body, which makes sense because the entire back or posterior of the body has been burned here. So half the body's been burned, so 50% of the body. Now the next top missed question. The client has partial thickness burns to the anterior legs and perineum. Ouch. Using the rule of nines, calculate the percentage of total body surface area affected. Okay, so anterior legs and perineum, which includes that measly little 1% for the peri area, womp womp womp, and 18% for the right and left leg, since only the anterior is affected, or the front. So the answer is 18 plus 1 is 19%. Now, once the total body surface area is calculated, then the volume needed for emergency fluid resuscitation within the first 24 hours can be calculated using the Parkland formula. So write this down. We take 4 milliliters multiplied by the kilograms of body weight and the total body surface area percentage. Now, this is not commonly tested on the NCLEX, so I wouldn't freak out too much, but it may show up on your nursing school exams. So let's do a quick little example. Taking from our previous question, let's say the client weighed about 100 kilograms with that 19% total body surface area affected. Now we're calculating the lactated ringer fluid of resuscitation needed. So using the formula, we're taking 4 mLs times 100 kilograms, let's just say, and from the previous question, 19% total body surface area. You take those bad boys, multiply them together, and the answer is 7,600 milliliters within the first 24 hours. Now, we give the first half of fluid in the first 8 hours of the incident, so around 3,800 mLs, and the remaining fluid we deliver over the next 16 hours, another 3,800 mLs. But again, I wouldn't focus on this too much for the NCLEX. This is mostly used for your nursing exams. Now for the treatments of major burns, as mentioned before, during the emergent phase, the number one intervention in the first 24 hours, hopefully you wrote this down, We give isotonic solutions like IV lactated ringers and IV normal saline. Now, how do we know if fluid resuscitation is working or not? Well, the assessment of fluid resuscitation, big key term here, urine output 30 mLs or more. Huge NCLEX tip. Make sure to write that down. Urine output is a vital sign that indicates fluid resuscitation has been effective. So that's why we say 30 mLs per hour or less means the kidneys are in distress. Now, the second key point of fluid resuscitation is blood pressure. So 90 systolic or more and a heart rate less than 120 beats per minute. This means that fluid resuscitation has been effective. So I'd recommend pausing your screen and jotting these down. These were the most tested for fluid resuscitation. So don't let the NCLEX trick you here. Electrolyte balance is not the best indicator of fluid resuscitation. It's always urine output, then BP, and then heart rate, the top three there. So Saunders mentions, a client undergoing fluid replacement after being burned 20% of their body about 12 hours ago. The blood pressure is pretty low, 90/50, a pulse rate of 110, and a urine output of 20 mLs over the past hour. The nurse anticipates which prescription. Okay, so look at the key terms here. The BP is definitely not looking good. We're probably going to slip into hypovolemic shock for sure. So increasing the IV lactated ringer solution is the best option. Now, once the client shows adequate urine output and urinating or diuresing over 30 mLs per hour, then we can administer enteral feedings once bell sounds return. Nutrition is always a priority, but only after fluid resuscitation. This helps the client meet caloric intake required to rebuild damaged tissues from a burn. Now, as the body heals with open wounds from major burns, infection is a huge deadly risk here. So Kaplan mentions, a patient with burns who is immunocompromised, what precautions should be taken to prevent infection? Now, the key words here are immunocompromised and prevent infection. So avoid placing fresh flowers or plants in or near the client's room. Yes, we always want to avoid crowds, fresh fruits, and all the typical stuff for clients who are immunocompromised to prevent infection. Now, during the rehabilitation phase, this happens when wounds fully heal and typically takes around 12 months or so, depending on the severity of the burns. Now, the big key point to write down is that infection is not a big risk here. As wounds have been fully healed, there's no more open sores. So don't let the NCLEX trick you here. Infection is not a big risk. 80% of students get this wrong. So pay attention to the W's here for patient education. Big NCLEX tips. First W is for water-based lotion, which helps to minimize itching and scarring to allow the skin to fully heal. The second W is to wear pressure garments. Yes, don't let the NCLEX trick you here. Wearing pressure garments are good to help minimize scarring. It also helps to keep the skin and tissues tight while promoting circulation to be able to fully heal. And E is for exercise daily with range of motion. This helps to promote movement and prevent stiff joints, and we always encourage sunscreen and protective clothing when going out in the open sun to prevent those darn sunburns. Alright, that wraps it up. Thank you so much for watching. Don't forget to take the